7:42 in Trinidad and Tobago. Well, the conversation surrounding vaccinate to operate, that was the mantra initiated by the government in the first week of June, I believe, and it's taken some time for it to roll out effectively. That discussion continues to attract many views, which ultimately leads to the question, should COVID-19 vaccination be mandatory? By now, we would have hoped that the government would have come up with some broad policy in relation to mandatory vaccination in the workplace, or some sort of guidance. We know as well of the discussions that have been taking place between elements of the business sector and indeed the union, the trade union movement, but still we're waiting to get some sort of direction in relation to the government's perspective as far as vaccinate to operate and whether or not it should be mandatory to be vaccinated to operate in the workplace. Well, it's going to be the subject of the latest episode of the UTT series and the virtual series scheduled for this Wednesday coming from 6 p.m. Among the panelists will be the president of the San Juan Business Association, Vivek Chara, no stranger to this program because he comments quite frequently on the business environment, especially in the time of the pandemic. Senior Counsel Douglas Menz will also be involved, the immediate past president of the Law Association. They are just two of the panelists scheduled to participate. Well, to tell us more about the event and also the approach taken by the UTT regarding vaccination, we are going to be joined now by the president of UTT, Professor Prakash Persad. Professor, I see you there lined up, ready to have a chat with us. Good morning to you. Thanks very much for taking the time.
Good morning, and thank you for having me.
Good to have you with us, Professor Persad. So just to reinforce our introduction, all is set for that latest of the series come 6 o'clock on Wednesday with that discussion?
Yeah, it's all set and ready to go.
And as far as the discussion, which will be, I know on the UTT's Facebook page and on the YouTube page and will be live streaming, how has the series gone so far from your perspective with all the different issues that have been discussed related to COVID-19?
Well, the feedback we are getting, it has been very instructive, well attended. I think last week's webinar, we had over 1,800 live views. And it goes on the YouTube, so it's generating a fair amount of interest. And we're hoping that it will inform the decision of the public as to what to do, and also government's decision as to the vaccination, as you mentioned earlier.
And what are you hoping comes out of Wednesday evening's discourse? Again, it's going to be from 6 p.m. if we're talking about this issue of vaccination in the workplace, because as you would be well aware, it's a very contentious discussion right now, and when you have all of these emotions being stirred up, what are you hoping will come out of the dialogue on Wednesday?
Well, we are hoping to give more information so people can make a rational and logical decision. And for information, and I will say it here, in the US, several universities are requiring everyone to be vaccinated, even visitors to the campus. And interestingly, recently, the University of Virginia de-enrolled some 238 students for failing to be vaccinated. And I think the issue is this. I mean, people, other than medical reasons, if your life is threatened by a vaccination, I think we need to be, as human beings, mindful of the health of those around us, our fellow men. And therefore, if we are saying, look, I don't want to be vaccinated because for whatever reason, like I said, other than medical reasons, then I think I would suggest, and I want to emphasize at this point, UTT is following the government's guidelines. So we haven't done anything extra. But I'm suggesting that we need to take some more, strict steps, more definite steps to tell people, look, it's your right not to get vaccinated if you so desire, but also it's a right of the employer, like UTT, for instance, ensure that the workplace is safe and secure for everybody. And therefore, we must take the rights of the individual in context and in conjunction with the rights of the rest of people.
And therefore, Professor, as you mentioned, the UTT obviously can't veer away from national guidelines or national policy because you are the University of Trinidad and Tobago. But what is that policy right now as far as people in the environment being unvaccinated? What is the situation?
So what we're doing at this point, we tried as much as possible to help people get vaccinated, right? We did tell them where to go, etc., right? Upon advice from the Ministry of Education and Health also. What we're doing now, upon request from the Ministry of Education, we are embarking on a program of voluntary self declaration of your vaccination status. So last week we put out a sort of survey asking people to indicate their status. And also in that survey, they were allowed to say that they were not prepared to so indicate.
And what sort of feedback have you gotten? Have you gotten that feedback as yet?
Well, we put it out last week, Friday, I believe, and sometime this week, and hopefully by Wednesday for the webinar, we can give a bit more data. But what I understand is that people have been told it's a matter of privacy, their medical records. And again, I think we need to say, hey, yes, that's correct. But also, the health of the others need to be taken. And UTT must take its job seriously as an employer to ensure that we have a safe environment.
And how do you see these things going? Not that you want to influence the discourse come come Wednesday, because I'm sure it's going to be a very interesting dialogue come 6 o'clock on Wednesday when we're talking about vaccination in the workplace. But how do you see this thing going, this discourse going?
Well, it will go as it's going now. Some people, for their own reasons, are refusing to be vaccinated. But I think we need to point out, as the data is showing, especially with Delta variant, younger people are getting sick. In fact, I was speaking to a doctor yesterday who happened to be my son-in-law, and was saying that a young man got COVID. He had no comorbidities, and his lungs were scarred, and he died. So I think this is a matter of life and death. That what we're doing when we have the unvaccinated amongst us, that what we're doing actually maybe putting a death sentence on some other people.
And because we are in the age of social media, and that it's quite obvious that is why there is so much discussion going on, because as so many people have pointed out, for decades people have been taking the polio, tetanus, diphtheria, yellow fever, cholera, everything you could name, without an issue. And yes, there would have been minimal side effects along the way. But now it has mushroomed because of social media, because of people who present themselves as experts, that they are given credence because they feed into people's fears. How do you combat something like that?
Well, it's difficult to combat. I mean, social media is both a blessing and a curse. When it started, it was democratizing information, so people could easily access information. But that should have been done with measures to put in place to say, hey, is the information being put out there accurate, valid, truthful, useful? And there are no such mechanisms. So at this point in time, I think we are facing the curse of the social media, or if you wish, social media is a double-edged sword for which we are paying the price.
Indeed, and but of course the genie's out of the bottle. It's virtually impossible to control it now. So is there an additional responsibility, therefore, from respected institutions, for respected agencies, we're talking about UTT as well, to ensure as best as possible that you up the message, that you do whatever is required to ensure that credible, reliable, verifiable information is put out there for the general public?
I agree with you, and this is what we have been doing, and it's a very rationale for the webinar series, to let people know this is what is happening and what is available. But as you know, I mean, social media, people refer to it as an echo chamber. Those people would listen to what they want to listen to, nothing else. And that is the challenge we have now. And I think it should be done in a nationwide effort. In fact, somebody pointed out to me, why don't we take a kind of election approach to this thing? As people campaign for elections, street by street, village by village, etc., why don't we take that approach here for this COVID-19 and go street by street and say, hey, this is the issue here, what you need to do, etc. So maybe that is something we need to do.
And with all the different issues that have been raised during this UTT series, and again the issue of vaccination in the workplace will be the topic at 6 o'clock come Wednesday. Have you gotten the feedback which encourages you that this particular series has been beneficial?
Yes, right. And also, like when I looked at the list of names of people who went for the vaccinations, right? And interestingly, I think almost all academic staff went. I get the impression, and I want to say this is a perception. I'm not saying I don't have statistics to back it up, but anecdotal information. It looks like people are being influenced by those who represent them in the working environment to say, hey, you do not need to do this. And I think if that is taking place actively, it is very regrettable, because the relationship between the employer and employee should not be an antagonistic one. Unions represent the workers, and rightly so, but also the institution represents the workers also. And in the case of UTT, I can tell you this, right? The majority of people are not represented by the union. And UTT, as an employer, must look after the interests of not only union members, but all members of all workers of UTT, all staff of UTT. And this is something I think we need to address and do it in a fashion to bring about some change, making it very clear. Nobody is trying to take advantage of anybody, but it's for the safety of all of us. You know, the analogy is like we're in a boat. We all will sink in it. It's as simple as that. If some are rowing and some are boring holes in the boat, we all sink, we all drown.
That's an important point. Professor Prakash Persad, President of UTT, thank you very much indeed for taking the time. I want to remind everybody the latest in this UTT COVID-19 series comes up on Wednesday. It's going to be on the UTT YouTube page from 6 p.m. and it should make for a very interesting dialogue when we talk about the challenges associated with vaccination in the workplace. Thank you very much once again, Professor, for taking the time to be with us.
Thank you, sir.
You're more than welcome, Professor Prakash Persad, President of UTT, the University of Trinidad and Tobago. Well, as we go to another break, here's an image presented by Latifa from San Fernando. Very nice, lovely variety of colors in the garden there. And now a couple images from David, captured at Edith Falls on an early morning. Very nice indeed. I suspect that might be somewhere out in the Northwest Peninsula, would it be? Maybe, but it's very nice, very lush, and in this time of the rainy season, very, very impressive indeed as we go to the break.